So today we are going to look at different types of botulinum toxins which are available in India and how to dilute them. So you can see we have different types: Botox, Nabota, Dysport, Stanox, and there's one more called as CX, which we do not have it here. So when you get a vial of the toxin, first you have to see if it is sealed properly. So this helps us to know the originality and it is not tampered. So usually they will be sealed like this. So it is sealed, and then you also need to check the batch number, manufacturing date and the expiry. So the way it is packed will vary with the toxin whatever is available. So in this case the seal is like this. You have to open and then you see. So check for the batch number, expiry. Now another thing if you observe is it is available as 50 units, 100 units and 300 units. So Botox is available as 50 units and 100 units. We do not have the 100 units vial here. Nabota is available only as 100 units. Dysport is available as 300 units. And Stanox is available as 50 units as well as 100 units. So here we are using non-preserved normal saline. And if you do not have the 10 ml vials, so it is fine to use the 100 ml bottle. So once you take the normal saline, you have to discard this. You cannot use it again for next day's dilution or dilution after few hours. If you have to dilute another vial after few hours, you are going to again take a freshly opened normal saline bottle. Fine. So when you are drawing, you have to check there are no air bubbles. So here I go. I'm almost at 1.3 mark. So here you can see that I'm exactly at the 1.3 mark. That is for diluting 50 units of the toxin. You have to check that there is no air bubble because that's going to change the dilution. Now for diluting 300 units of Dysport, we need 3 ml of normal saline. So here you can see the syringe has normal saline up to the mark of 3 ml without any air bubble. This is how the packaging of Botox looks like. So you need to open it from here. So now if you look at this vial of the Botox toxin, it looks empty, right? But when you see closely, look at the base. You can see white powder stuck to the base, and that is the purified toxin. So now we will uncap this without touching the center. So you just uncap. Never touch the central part with your gloves. We have already drawn 1.3 ml of normal saline into this syringe. So you have to actually pierce it like a stab and point it towards the wall of the this glass bottle so that there is less of foaming, and you will observe that the saline, normal saline, is sucked on its own into the vial because of the vacuum which is present in the vial. So I'm just stabbing it, directing to the wall, and you can see the normal saline was sucked inside with the vacuum. If this doesn't happen, then you have to discard this vial. Now next thing what we are going to do is to remove the air bubbles or remove the air or the vacuum which is present in the bottle. So how do we do that? Hold the needle, just unscrew the syringe. So you will hear the air sound. That's it. And gently rotate in between your palms. So this toxin, we do not have to shake it vigorously. It might affect the potency of the toxin. So gently roll till you see a crystal clear liquid. So now this toxin is ready for use. So I'm just removing the needle from this. Now let's see how to dilute the Dysport. So Dysport comes as 300 units and we are going to use 3 ml of normal saline. So in Dysport, you see the actual powder. So you can see the white powder which is stuck to the base. So this is the purified toxin here. So this doesn't look like an empty glass vial which was seen in Botox. For this, we are going to use 3 ml of normal saline and this is not vacuum packed. So we will have to push the normal saline into the vial. So here again, we just flipped it open and we are not going to touch the center. I'm inserting 3 ml of normal saline again like a dart. And we are pushing the normal saline. So now here, since there is no vacuum, we need not remove only the syringe. We can take out the entire needle and then just again, as we did earlier, we are going to roll it till the entire powder is dissolved. So now you can see crystal clear liquid and our toxin is ready to use. So similarly, we can dilute 100 units of Nabota with 2.5 ml of normal saline, the 50 units of Stanox with 1.3 ml of normal saline, 100 units of Stanox with 2.5 ml of normal saline. And CX is also diluted similarly with 2.5 ml of normal saline. Once you have diluted the toxin, it has to be ideally used within 4 hours, but it can be stored in a refrigerator, never freeze it. It has to be stored in the door of the refrigerator between 4 to 8 degrees Celsius. And for further information how long you can store it, you can just refer to my lecture which I've already discussed about this. So when it comes to units, the units of Botox, Nabota and Stanox are interchangeable. So the potency lies 1:1. But when it is Dysport, 1 unit of Botox is equivalent to 2.5 to 3 units of Dysport. And when we are injecting, we are going to use this insulin syringe which has 40 marks on it. So 40 units or 40 marks is equal to 1 ml. The units are referred to as the Botox units. So 1 unit of the toxin or 1 unit of Botox is equivalent to 1 marking on this syringe. Fine. So when I say 10 units of Botox, it is going to be 10 units on this 40 units insulin syringe.